base with everyone. We in this. We up in this, y'all. This coronavirus thing is real. It's here. Gonna be with for a little bit. Um, Despite what some people say, the Easter Bunny is not going to come hop along and magically take it away by Easter. So it's gonna be with us for a little bit. So hey Patricia, thanks for joining. I hope you are okay in the DC area up there. So I wanted to just spend a few minutes tonight wearing my medical hat. I know this is my page where I kind of goof around and, say inappropriate words and, fantasize about Idris Elba. But I am a physician, board certified, and I just wanted to reach out and let everybody know some things that I wanted to just share with you. I hope you guys have been check out my blog. If you haven't, go to drmoniquemay.com. I've got several good blogs on there, all coronavirus related. The one hot off the press today is about foods you can eat to help you boost your immune system. So check that out. So I just got back from my parents' house. My parents live near here, and I had called them to make sure that they were taking precautions while opening their mail. Hey, Dave, how are you doing? Good to see you. Thanks for joining. So I don't know if you all have heard, I'm sure you've heard, but there's a lot that we don't know about this virus, but there's some good information that can live on certain surfaces anywhere from 3 hours, that's more so in the air where it's aerosolized, to up to 3 days on certain surfaces. Cardboard, plastic seems to not do well on copper from what I've heard. So if you're getting your mail or if you go out grocery shopping, anything that's been touched recently, you want to take precautions when you're opening those things. So your mail for one, right? So they didn't have any gloves. So Mitchell and I took some gloves over there, social distancing, just waved at them from the door, told them to, wipe them down. Although they've been in my house since before the coronavirus thing. So they probably are okay, but still, caution them to use the gloves to go get the mail, open the mail, and then wipe down the table where they've read the mail, where they've opened the mail. So just stuff that you really have to be conscious of that we, 2 weeks ago weren't doing. So this is our new normal. So I wanted to spend a few minutes to talk to you guys about what else you should be getting or what you should make sure you have in your house in addition to the food and the toilet paper, milk, bread, all that stuff that you can't find on the shelves. I want to make sure you guys are mindful of having the basic first aid kits and equipment in your home. So as I mentioned, I took them gloves, but it's good to have some gloves in your home in case of emergency. Because let's think about this. We're telling people stay away from the ER. Most people are not going to urgent care. We're trying to limit all unnecessary contact, but things are still happening. People are still getting sick. They're still getting cuts, bruises, burns. Hey, Gail, thanks for watching, cuz. So things are still happening. Life is still going on. But I want to share information with you guys that you can hopefully treat some things at home and not have to go sit for hours in an urgent care or an ER. Also, be mindful and avail yourself of telemedicine options. I do quite a bit of telemedicine now, and we are busy, and anything from stuff that's not related to COVID, because again, things are still happening. People are still having other health issues, all the way up to yes, information. Thank you. I hope this is helpful for you. All the way up to just people wanting to talk, even if they're not having physical symptoms with the cough and cold and shortness of breath or whatever symptoms they may be having. They want reassurance because people are scared, and people whose depression and anxiety that they already have at a baseline, some of that is ramping up. And so people are having concerns. So hi Pamela, thanks for joining. So telemedicine serves a very valid purpose because it can be reassuring And even, on the video, we can see certain things that can be treated appropriately or given advice appropriately and save that person a visit to the hospital or urgent care. So, but some things that you should have at home. Every house should have a first aid kit. Before coronavirus, if you've got, well, I was going to say children, but any house, because you can always cut yourself in the kitchen. You can have a burn. You can have things happen. So it's good to have a first aid kit. And be sure you check the expiration date, because guess what? First aid kits do expire. Those Band-Aids have expiration dates. They get a little brittle if they've been in here too long. The alcohol pads may dry out or expire. So if you have a first aid kit, be sure to check the expiration date. Make sure everything in there is still good, because a lot of them have medications like acetaminophen or ibuprofen. And again, those will have expiration dates. So just check yours out and make sure it's good to go. And if not, just replenish what you need. If you don't have one, please get one. You can order one. I don't know what that stuff is looking like now on Amazon, but you can, but if you're going out to the store, you still look and see if they've got first aid kits that you can get. The basic one is fine. You don't have to have the one with, 8,000 pieces. You want one basically that has, antiseptics, bandages, gloves. Some have tongue depressors, scissors, just basic wound care stuff, cold packs. So those are the ones you want to make sure, and you don't have to think about it. You can just get a first aid kit, but that's what you should have. Hi, Nicole. Thanks for watching. So first aid kit, you want to have ice packs on hand. Stick them in your freezer now. You don't want to wait till you need them. You should always keep some handy. I have some all the time because I have, my knees are disrespectful, and sometimes after I've overdone it, I need an ice pack or 3. So I keep some. But it's good to just have some on hand. If you don't have a, fancy dancy one, you can always, improvise. They say necessity is the mother of invention. Get a Ziploc bag, fill it up with some water, freeze it. If you lay it flat in the freezer, you'll have an ice pack that you can use. You can also just use frozen peas, frozen corn, whatever you've got in your freezer in a pinch. But it's good to have a couple of ice packs on hand just in case. That's going to be good, of course, for bruises, contusions, things that tend to swell up. In the first 24 to 48 hours, you want to apply ice, because that helps constrict and shrink down blood vessels and decrease blood flow into the area, or decrease the swelling. That's the body's normal reaction to injury. So in the first few hours or days of an injury, ice is actually better. And then after that, if you want to do heat for the comfort, you can. But heat does what? Tends to make things expand. So in the initial stages, you want to do ice. Pain relievers. Tylenol or acetaminophen, good to have on hand. It's a fever reducer, pain reliever. It's safe in children. Of course, if you have liver problems, you want to be careful with that. If your doctor has told you not to take that at all, then you need to be mindful of that. I've gotten a couple of questions about ibuprofen or Motrin, because there's been some information coming out from other countries that are dealing with this, that patients that they were seeing who had a worsened course or bad outcomes were also found to be taking Motrin or ibuprofen. We don't have hard and fast data here, to my knowledge, in this country yet. And you want to be careful, because something that's observed in one population may not necessarily translate or correlate to another population. But for now, since there is some question about it, I would recommend just using Tylenol or acetaminophen, just to be on the safe side, as long as, again, you don't have any underlying liver problems that would prohibit you from using that. I guess, let me go back, because I should have said at the top of this, a disclaimer. I am giving general medical advice. Of course, you need to personalize this based on the advice of your physician, who knows you and your health conditions. But generally speaking, for the average healthy person, the stuff that I'm saying is going to be appropriate. But make sure it is right for you based on your condition. So if you have liver problems and your doctor has told you not to take Tylenol, don't say, well, Dr. Monique said to go out and get Tylenol, because that's not what I'm saying. The other thing too is medications. both prescription and over the counter. So make sure that you have, for your prescription medicines, make sure you have at least a month. If you can get 3 months, go ahead and do that. A lot of the insurance plans want you to get your 90-day supply because it's cheaper than if you buy it month to month. So if you haven't done that, go ahead and get your 90-day supply. Not telling you that to panic, but it's just good to have it. Your chronic medications, go ahead and get those. The same thing with over-the-counter medicines. So if you take stuff for your stomach or, cortisone cream for your athlete's foot medicine, whatever over-the-counter medicine that you kind of use fairly regularly, just make sure that you've got some of that on hand. And the other thing I want to mention is Dermabond. So Dermabond is skin glue. So if anyone here has had a minor cut or laceration that didn't require stitches and they got their skin glued, you know what I'm referring to. So basically, and I just found this out today, I did not realize you do not need a prescription for Dermabond. It is medical grade, it's FDA approved, is what we use if you come to the office to get, if you have a cut that's not deep enough for stitches. But I want to just give a few pointers about how to use Dermabond and what kind of wounds are appropriate for Dermabond. Dermabond is meant for fairly deeper than a paper cut, but not so deep that you see the white meat, or that the edges, so it's a straight cut, it's a linear cut. Typically you're cutting in the kitchen and you nick yourself, that kind of thing. So a fairly clean environment, which is low risk for infection. If it's located, hey Janine, thanks for watching. If it's located, arms, legs, not really recommending for the face. So pretty much from the neck down, in the major areas, arms, legs, those types of, hands, arms, legs, that type of thing. Again, fairly deep enough that they're bleeding, but not where it's heavily bleeding and it's not jagged. There's no pieces of flesh missing. This is not meant for that. Hey Tasha, thanks for watching. It's not meant for animal bites or human bites. So puncture wounds, not what you want to be using Dermabond on. Because if you think about it, if you seal off that surface and now bacteria are just, chiming away in there. So this is for, again, hear me and hear me well, fairly superficial, straight, straight line, no tissue missing, no signs of infection. You don't want to do this if after, days later. This is initially after you've cut yourself. Those are the type of wounds you want to put it on, and from the neck down, not for the face. So Dermabond is fairly easy to use. I'm sure you can, Google and find YouTube videos, but that's good to have on hand as well. For cuts that you might otherwise go to urgent care for, it's good to have that on hand. You want to, of course, clean the wound, soap and water, really well, clean everything out. Apply pressure, make sure that the bleeding is slowed. If it's a gushing wound, again, we're not talking about that, but you should be able to get it to the point where it's slowing down, where it's slowed, and then you want to basically hold the edges together. I can't seem to, where's the camera? But basically hold the edges together, and then you would apply the Dermabond on, kind of like you're painting. So again, there's videos you can watch for much more details if you actually need it. But that, I think, is good for someone to have in their arsenal at home. There's also been talk, and some of you may have heard about this, may not, about whether you should have, what home monitoring devices should you have. Hi Renata, hi Sheila, thanks for joining. So what home monitoring equipment should you have? A lot of us, myself included, have high blood pressure. So a lot of us tend to have our own home blood pressure monitoring kit. So that's definitely good to have. A thermometer is a must. Hopefully you've got a good working thermometer. Lots of different bells and whistles versions, doesn't matter. Just get something that works. There's also been talk about having home pulse oximeters, which are, if you've ever been to the ER or the doctor's office and they want to check your oxygen level. And I actually have one. I'm sorry, I don't have it handy. but you just you stick your finger in, and it's kind of like the ET phone home finger. So that's a pulse oximeter, or pulse ox for short. So that's good to have on hand. Some folks are advocating having that because then you can, if you start having symptoms, you can check your oxygen level, because sometimes people don't look as sick as they really are. And by having a good idea of what the oxygen level is, you have a better idea of when it's time to go to the hospital or call 911. So, and those are good things to have on hand too, because if you're using telemedicine and I, as a doctor, am talking to you, and you can tell me, my pulse ox, my oxygen level is 99%. That's definitely reassuring. That's what we call objective data, meaning something that you can measure. You can measure your temperature. You can measure your oxygen level. You can measure your blood pressure. So if you have those things, those just good to have on hand, particularly if you're caring for elderly, loved ones, people who may have immune system compromised for whatever reason. They're on chemo or HIV or chronic illnesses, diabetes, that suppress your immune system. That's good to have on hand. And speaking of diabetes, of course, hey Terry, thanks so much for watching. I'm just talking about some things you can have at home to help prevent trips to the ER and urgent care. Speaking of diabetics, of course, you want to be in contact with your doctor. Watch for any signs of infection. You want to report those. Watch your blood sugars. Your blood sugars may start telling you something's going on before you may feel it's going on, right? So diabetics are not always quite aware of changes in their body because of the damage to the nerves from the sugar. But if you've got your heart rate monitor, you've got your thermometer, you've got your oxygen level, those things, and your blood sugars you're checking, those are ways to be able to know when you may be getting into a little bit of trouble. So you guys, this is also one-sided. If you have questions, please, I know you guys have to have questions. Please jump in there, put them in their comments. I'd love to respond to questions while I'm on air with you guys. So I just wanted to again, share information. Obviously, we all are starting to look a little, kind of like with the club when the lights go up, after you've been dancing all night, you're like, ooh, wait a minute, you were cuter 3 hours ago. My hairdresser actually called me, I think like Monday or Tuesday, and asked did I want to get in, and I was like, girl, no. I mean, I do, but I can't. I can't risk it. And it takes about 6 hours to do what she needs to do. So the whole 6 hours, I'd be just sitting there thinking, oh God, Rona. So no, I had to turn her down. I'm gonna have to give her a really nice tip, because when this is over and she gets back to my head, I just told her I'm gonna apologize in advance, sis, because I'm gonna feel for you. People have been posting their raggedy fingernail pictures. I mean, it's hard. Somebody was like, we are not okay. We are not. We divas, we pretty girls, the high maintenance. This is rough, but that's okay. That is okay. We're going to come through this safe, and sound, and, and healthy, because of course, at the end of the day, y'all know I'm just kidding. It is beauty is what counts is on the inside, and ain't no beauty worth your health. So all jokes aside, it is not worth it. So I'm glad that measures have been taken to help people stay at home, because some of us don't always use common sense that God gave us and make choices that put yourself or others at risk. And so if you're non-essential, and don't need to be out, please stay indoors. So Terry, how to proceed with normal life after this, precautions? That is a great question. I mentioned before, this is like 9/11 to me. Kind of pre 9/11, post 9/11. So I know medically, myself and my colleagues have been talking, things are going to be different medically, how you go to the doctor, how you access healthcare. I think we're going to see definitely much more accessibility for telemedicine, better insurance reimbursement for telemedicine, penetration into rural areas where people really need telemedicine. It's not just a fancy thing to say, oh, let me talk to my doctor on my phone. But in rural or even urban areas where there's lack of access of doctors, lack of primary care, telemedicine is a huge tool that is being underutilized and is now kind of blowing up. So definitely, for one, healthcare is going to be impacted both from on the patient side and on the physician and other provider side. I think the way we just deliver goods and services, is going to change too. Someone's going to come up with a better way to, build a mousetrap, so to speak, because as we are going to see, and we're going to be relying more on delivery or pickup or takeout rather. I think there's going to be some genius that comes up with a way that kind of disrupts that. That's this whole process. This whole corona is what we call a disruptor. And so definitely proceeding to normal after this is not going to look the same. It's not going to look the same. It just can't, because we were caught sleeping. Bottom line, we were caught sleeping. And so we can't go back to how things were. Just being real. So good question though. And of course, the finance world, right? What is that going to look like? What is air travel going to look like? I mean, you name it, everything is what is education going to look like? I mean, it's not funny, but, I told my son, oh, it only took a global pandemic for you to get your wish to be homeschooled, because he's wanted to be homeschooled for years. And I was like, what? No, who's going to homeschool you? No. So, but here he's being homeschooled. And so, everything is going to look different. Education, retail, you name it. So great question. Tasha says, I pray that this will truly help us to put things into perspective and what really matters: health, jobs, and family. That is such a great point. Being forced, to be present, right? To be with our families, to be present. You're not having to go to 5 different things. There are days in my calendar where I'm just like, if I have one more meeting, I'm going to cry or whatever, because like literally Monday, Tuesday, Wednesday, Thursday, and sometimes 2 or 3 at the same time. So to my knowledge, we haven't invented cloning, like legit cloning of humans. So how are you going to be at all these meetings? So to go from 60 to 0, not 0 to 60, but from 60 to 0, like that has really been making people really take stock and getting to spend time with their children and their loved ones that they didn't have before. So hopefully we'll come through this with some some remnant of that. I mean, people tend to revert to habits once restrictions have been lifted, but we'll see. We'll see. But yeah, it definitely is putting things in perspective. Your loved ones, y'all, check in on them. I had to my parents are from big families, and so I have a lot of aunts and uncles and cousins, and I have a good number of folks in Queens. And I don't know if you've heard, but New York, of course, I'm sure you've heard, New York is just off the hook right now with coronavirus. But out of the cases in New York, 1/3 of them are in Queens. So out of the whole city, 1/3 of the cases are in Queens, and there's this one particular hospital, Elmhurst, is getting hit just so hard. So I called and checked on my people and like, look, I need for y'all to stay in the house. Like, this is not a game. So hey Naka, thanks for joining. So you've got loved ones, check in on them, use your FaceTime, use all your social platforms that you can. I'm loving, by the way, I'm loving seeing everybody post their videos of their dancing and their exercise challenges and their just their realness, like what they are dealing with to stay sane and healthy during this time. So New Rochelle is the epicenter. I hadn't heard that. I know Queens is pretty bad. I didn't know New Rochelle was that hard hit too. Um, but yeah, so keep up the good work, guys. Whatever y'all are doing to stay sane, post it, share it, because humor is really the best medicine. And so when I see funny stuff, it is great because it's easy to get overwhelmed with the deluge of just constant information coming in. I have to, again, it's like 9/11. When 9/11 hit, once I knew all my people were good, um, I couldn't turn off the TV. Like I remember sitting on my couch in my condo just watching CNN over and over and over. And now I'm not watching CNN as much, but I'm on the app all the time. And so, or I'm watching I look, check out the Johns Hopkins tracking where the numbers are just growing, growing, growing. So, you got to find the balance. You got to unplug. Um, and do something that takes your mind off of it. I've been running. My knees have been letting me run, so I've been running on my treadmill. And so I do this whole cool down. I pick a song where I just cool down and I just like, I just feel like I'm on stage somewhere. I really need to record it and upload it because I think it's actually pretty good. So, and then I looked at my watch and I was still burning calories because I was dancing. It was supposed to be my cool down, but I was really, burning some calories and having some fun. So, hey, Tamara, thanks so much for joining. So, guys, I'm going to get out of here. I hope this has been helpful information. But just to recap real quickly, stuff that you can have at home to, hey, Edna, thanks for joining, LS. Um, just make sure you have a current and well stocked first aid kit. Make sure you don't have any expired stuff in there. Get rid of it, replenish, get some new up to date current medications and supplies in there. Have your gloves on hand, have your ice packs on hand. Hi, Audra, thanks for watching. Tylenol, right now there's an unofficial recommendation to use Tylenol versus Motrin just because of some anecdotal reports that people who were taking Motrin who have COVID were having worse outcomes. So again, we don't know exactly how that translates to America, to what we see in the United States, but right now they're recommending Tylenol if you have a healthy liver. Have a supply of your over-the-counter medications, your prescription medications. Try to get a 90-day if you can. Hi, Ashley. Thanks for watching. David, thank you so much for watching. I hope this was really helpful. You're certainly welcome. And Dermabond. Try to get your hands on some Dermabond. You don't need a prescription. It's the same stuff that we use in the office for minor lacerations. And that you can do at home. Oh, one other thing, speaking of lacerations, of course, if you do need Dermabond, you want to keep the area clean and dry. If you start to notice redness, pus, swelling, pain, Tamara, thank you so much. Please do. Anything that doesn't look right, that of course you need to be seen. But for the typical low risk laceration, a part of the body that gets good circulation, lots of blood flow, Dermabond's going to be fine. That being said, if you have diabetes or you have poor circulation in your legs and feet, you would not be a candidate for this. Again, I'm talking about healthy people, good plasma, good tissue, good skin, a good healthy environment. Those are the people we're talking about Dermabond. If you compromise in any way, this recommendation is not for you. But again, just something to have on hand because we're telling people, until we flatten this curve, we need people to stay away from the ER. I heard one doc say, can we handle 1 million cases of COVID? Yeah, we can handle it. Can we handle them all in a month? No, we can't. We can handle them in 4 months. And so that's why we're telling people to stay home. That's why we're telling people, hi, Dr. Ferlandi, thanks for watching. We're telling people to not congregate because when everybody gets sick at the same time, that's not good. That's not good. So hashtag flatten the curve, hashtag stay home, hashtag cut your cough, hashtag love on each other from afar. And what's the one I saw? Oh, hashtag apart but not alone. I thought that I think is very powerful. We're apart, but not alone. And if you are feeling alone or overwhelmed or stressed out during this time, please reach out. Reach out to me. If you don't have anybody else, reach out to me. Reach out to somebody, because we all are in this together. Question: should you go to the grocery store? Oh yeah, you actually got to go to the grocery store. If you can have your food delivered, that's great. But no, grocery stores, even in the cities like Charlotte, where we are, Charlotte and surrounding counties are where we are. The stay at home is in place. The grocery stores, I think, were the top thing on that list. You got to get your food. Can you go outside or homes for fresh air? Yes, please. Please go outside for fresh air. Fresh air is so important. Vitamin D from that sunlight, and just to get out, exercise outside. Still do your social distancing. If you see people coming up close, or you're approaching someone walking your way, cross over, cross the other side. But yes, definitely do that. Hi, Katrina. Thanks so much for joining. Actually, I wanted to go back to your question about the grocery store. Yes, definitely go. Be sure to, when you come home, well, first of all, when you're in the store, wipe down a lot of the stores now are giving out gloves, they're giving out wipes. Wipe down the surfaces you're going to touch. Now is not the time to be picking up stuff and putting it back on the shelf. Oh, I think I want this, I think I want that. Go with purpose and touch something just one time, know what you're going to get it, put it in the cart, and move on. Just to, again, decrease the touching. When you come home, you want to wipe down your countertop. Preferably, I would recommend leaving if you can, put the bags on the floor because they've been out. So I would leave them on the floor, put the food up on the counter, and you can start to unpack. If it's been in cardboard, take it out, put it in like cereal. For example, cereal boxes are typically cardboard. They're recommending that you can get rid of those, but the plastic inside, since it typically has been more than 3 days since that was packed and shipped to your store, the plastic bag inside should be okay. So you want to just be mindful when you are unpacking and putting your groceries away, or if you have your food delivered, you're having a takeout meal delivered, then you just make sure I would say take those things out of, take the food out of those delivery containers and put them in your containers, wipe down your surfaces and wash your hands. I've got a blog on my page about 5 tips on how to practice social distancing while ordering food. So you should find some helpful tips there. So Ashley said she's worried about her babies. Yeah, I'd be concerned about you if you weren't worried. But yeah, if you have, another thing too is when you come home, if you've been outside, change your clothes. Just like, allergy season, we tell people, especially if they have bad, allergies, take all that stuff off, take a shower, wash your face, wash your hands. If you can, wash your hair. Oh, Ashley, you're welcome. Thanks for that question. So to just decrease the load, the risk. So if you go outside, come in, just hop in the shower, just to kind of reset. Definitely don't want to lay down and go to bed in those same clothes that you've been out and about in. So great questions, guys. If you have any more, hey Mimi, thanks for joining. If you guys have any other questions, be sure to post them. I promise to respond to your questions. I'm at the house. What else am I gonna do? But no, seriously, if you have questions, please be sure to share, to post them, and I'll do my best to get back to you. You guys be safe, stay well, drink your water. I'm almost done with mine for the day. One thing that I've done, and you guys can do, yes, you should do that anyway, Josh, you're right, is because water can be boring. And some of those flavor packets, you may think, oh, I'll just get those flavor packets. Some of that stuff has sorbitol and saccharin and things that can actually, like the sugar, the sugar content can kind of sit in your stomach and ferment, and you get those bubble guts and some other unpleasant effects. So why even bother with that stuff? Plus, some of that stuff can be expensive. If you've got lemons in your house, oranges in your house, pineapples, whatever fruit, and then you can put some ginger. So my favorite thing right now is lemon basil ginger water. So I've been slicing up. I'm out of basil, so I didn't do it today. But you've got your antioxidants, your vitamins, your minerals. Lemon, of course, vitamin C. Your basil, I believe, has vitamin C and K, which is good for normal blood function. And so you can just sip on that throughout the day. I also put a little ginger in mine. Ginger is a good anti-inflammatory as well. So that gives it like this nice little flavor, and it, it's not just boring water. And before you know it, you've hopefully reached your goals. So I'm gonna get out of here, guys. I'm gonna go do something in the kitchen, I'm sure. But take care and stay in touch.